What does your job consist of?
We see patients both from outside in the community. They come into our department, or patients that are in the hospital after surgery or for a specific acute diagnosis. We evaluate them. We formulate a care plan. We carry out that care plan. We reassess them when the time comes, and then we discharge them, hopefully, with the tools they need to continue their success with therapy. Anything?
Treatments include ultrasound, electrical stim, traction for both cervical and lumbar, exercise, home exercise instruction. For inpatients, we use a CPN machine for total knee replacements. The types of patients we see would include orthopedic, neurological, vestibular rehab, back pain, neck pain. That would encompass most of what we see on a daily basis.
All right. And then, what is the number one problem patients typically have due to their injury? Is it because of a sports-related accident or because of a health issue such as stroke, heart attack, like health issues?
I would have to say, in my experience, it would be low back pain, and I don't really think. I would say that the majority of low back pain is due to poor lifestyle decisions, overeating, not exercising as you should. We do on occasion see back pain from an accident or car accident or doing something at work that you injure yourself. But I would say the majority is just sedentary lifestyle, lack of exercise, poor diet, maybe poor posture, poor body mechanics, and just not really taking care of themselves.
Yeah, I would say neck and back pain would be our number one diagnoses that we treat most consistently. And then everything else is more spread out over post-surgical patients and neurological problems.
Right. All right. And then, what do you think people struggle with after leaving here, like such things as performing exercises that you give them?
That would probably be compliance would be the number one issue we deal with. For somebody to come for physical therapy, 90% of them need to maintain a home exercise program after discharge, and that would be the reason that we see, I would say most often, recurrent patients returning after 6 months or a year, saying, oh, basically have the same problem. Have you continued to do the things we taught you to do? And that would be no.
Right. And then,
I would agree completely on that.
Right. And then, my last question is: given today's health status across the world, would you consider it good or bad?
I would say poor.
Poor.
Yeah. I think we could be doing a lot more preventative type of programs,
Mm-hmm.
not just nationally, but pretty much throughout the world. Whether it be on a base level of educating people as to healthier living styles, what they can do to prevent certain issues from even occurring. So if we could work on preventative, I think it would help a lot with the status of our healthcare now, because we're spending so much money on emergency room visits and accidents and strokes and back pain that could really be prevented with a little bit of education and maybe some
Right.
a little bit of foresight. So.
I think we're fortunate on the Outer Banks. It's a relatively active community, so I don't even think we see as much of some of the issues that might be seen in other communities as far as obesity and
Thank you.
You're welcome.
Mm-hmm.
Okay.
Right. What does your job consist of?
My job consists of every day I come in, I review all the patients in the hospital. I do nutrition assessments on the ones that are identified to be at nutrition risk, whether it's based on their current diagnosis, whether there's certain risk factors that are listed on their admission assessment. So if any of those are triggered, I'm consulted. And if a physician consults me, I decide and develop a list of who I go see. Then it requires me to look at their lab values. I look at their past medical history, their diagnosis, the medications they're on, and develop a nutrition care plan for them, which could include diet education for recommendations to change their diet or nutrition plan. I also see outpatients. That takes up the rest of my day, and that would be where physicians make referrals to me to see a patient based on maybe they're newly diabetic, maybe they have high cholesterol, maybe it's a child who's overweight, any of these things, they would refer to me, and then I see those patients and do diet counseling with them.
All right. And then after helping your patients, what do you think they struggle with when they leave?
Compliance,
Compliance.
just following through and doing, really making the changes. Many people want to do short-term fixes and versus these long-term diet and habit changes.
All right. And then my last question would be, given today's current health status around the world, would you consider it good or bad?
I think it's declining. I don't know if I would actually make a distinction between good and bad. I think there are definitely some areas that are bad, and there are other areas that are better than some. But I just think overall it's declining. I think the quality of our food is declining because we're moving more to these convenience foods, these processed foods, so we're not getting the nutrients like we used to get when we ate more whole foods. So I think it's just declining overall.
What would you recommend that should be done to prevent this?
I think we need to get back to eating whole foods, more clean eating, eliminating the processed foods from our diet, really kind of getting back to more home cooking kind of things.
All right.
All right?
Thank you.
You're welcome.